Good morning, ladies and gentlemen. My name is Marcia Gordon, and I'm President and CEO of the Business Council of Westchester. And we are so pleased to be here today to discuss and learn about a very, very important topic for all businesses, large and small. And it's about employer plan health trends and strategies for the not so distant future. Seems like we're talking about the not so distant future a lot these days. And we couldn't be more pleased to have Mercer join us this year as a sponsor of many, many of these webinars that are HR related, because Mercer brings strategic expertise to all things HR related, from health and benefits brokerage and program strategy to workforce planning and HR transformation to retirement and investment services. They offer thought leadership and consulting services that address all areas of the human resource function. Mercer is part of the Marsh McClellan family of companies, which include Marsh, Guy Carpenter, and Oliver Wyman. Together, they serve companies in the areas of risk, reinsurance, business consulting, and human resource strategies. And we are so pleased to have today Teresa Buccello, who's a senior principal and health consultant and relationship manager in Mercer's Norwalk office. In addition to serving as client manager in the tri-state market, she's responsible for providing strategic consulting to plan sponsors, leading client teams on day-to-day execution of strategy. By developing a deep understanding of her clients' business objectives, Teresa is able to share relevant leading practices, trends, and insights to help her clients deliver expected results and meet desired goals from a total rewards perspective. I love that. Results, goals, rewards. Makes it sounds like you get things done. Teresa has developed more than 20 years of experience working with corporate and not-for-profit plan sponsors to develop innovative, cost-effective, and engaging employee benefit strategies to meet their organizational objectives. She has expertise in financial analysis, plan design, health management programs, and various funding arrangements. Teresa currently sits on the Westchester Sheeran Board and holds other board level and committee positions with several local not-for-profit organizations. She is passionate about contributing to help further their work within the communities they serve. Prior to joining Mercer, Teresa worked as the director of the Employee Benefits Division for a brokerage firm, leading a team of consultants and account managers. And prior to that, she was a client manager for another regional brokerage firm. We're not working, which isn't a lot of her time, but I know Teresa does value some work-life balance. She can be found spending time with her husband, 3 sons, 2 dogs in Yorktown Heights. They love to travel. They're a sports family. She spends a great deal of time on the football and lacrosse fields, as well as mat side for wrestling. Teresa is a great expert. She's been a wonderful, wonderful addition to the BCW team, is a member of our HR council. If any of you on the call don't know the BCW or the work that we do in human resources, please reach out and contact Linda Tyler. I know Grant Schneider and Allison Madison, our co-chairs for the HR council, are also on. But it's my privilege to turn this webinar over now to Teresa Buccello. Teresa will be taking questions probably at the end. And so please put those questions in the chat and she will be monitoring those. So Teresa, it's all yours.
Thank you so much, Marcia. What a warm, warm, warm introduction. We are absolutely thrilled to be partnering with the BCW as such an amazing organization serving employers in Westchester County. So we are really happy to have this partnership. And thank you for your time today. And I'll be very mindful of the time, so a lot to cover, so we'll jump right in. So when we think about the road ahead and employer plan health trends and strategies, the future is here, right? when we wanted to start really today and talk about our survey highlights, and then we'll take the information that we gather from the survey highlights and then really start planning around what some of the potential strategies are, what are things that you want to be thinking about as you move towards 2022 and beyond really at this point. So for those of you who may not be familiar with our national survey, we do have the longest running survey of employer-sponsored health plans in the United States, and we're really proud of that. So this marks our 36th year. We have over 1,800 employers who participated in 2020. Usually that number's a little over 2,000. It was a little bit lighter than normal, but not a surprise given all of the competing priorities during the pandemic and the timing of when we collect data. So the survey does include employers of all sizes, industries, and regions. Typically, we are focused on the 50 or more marketplace, just to ensure that we have enough statistically valid data. You'll also find throughout this presentation, we are citing a few other surveys. So throughout all of 2020 and into 2021, we continue to do this. We've had pulse surveys. So we've had conducted global surveys almost monthly since last February. And in addition, we also have a separate COVID vaccine survey where we had US employers participate. So there's going to be some sprinkling of that information throughout the presentation this morning. So as we go on and think about the survey data, there are really three key areas of focus for employers. So managing cost by seeking higher value healthcare, planning for a larger role for virtual healthcare. So that's probably not a surprise for most of you, and we're going to definitely dig in more there. And ultimately understanding the needs of your different employee populations. So designing a program that is really going to maximize the value for all in all of its forms. We've organized the survey results into these categories to show really what employers across the country are doing in each area. So we start really by looking at cost trends. And when we look at healthcare trends, we know that they've been disrupted by COVID, and they are definitely making cost projections a bit more challenging for 2021 and beyond at this point. So cost growth is still somewhat of a moving target. We do have to keep in mind the survey was actually in the field July through September. So when employers provided costs for 2020, a lot of them were basing it on just 6 months of experience. In a normal year, that's solid enough. That's enough for a solid projection, but the disruption in healthcare utilization really meant that the cost trends were disrupted also. So maybe if you're larger and self-funded, you may have already adjusted your cost projections for the year by the summer last year. But many others were had just provided their original budgeted costs. So final story really of 2020 costs and 2021 cost estimates, really the 2021 cost estimates may not be known for a while yet. So we do think that there's going to be a little bit of a rebound after the pandemic eases in terms of people seeking elective care. And for any healthcare employers that are on the phone, you may be seeing some of that already. Some of the care that was postponed in terms of those surgeries, some follow-up appointments, we're starting to see that happen again. And the cost implications of continuing care. So for that long haul COVID-19 patients, and really what the future holds in terms of so much unknown is a little impossible to estimate at this point. This particular graph is one that depicts the change in total health benefit costs per employee compared to CPI and workers' earnings. So that's something, we've followed this, and if you've partnered with Mercer, you may have seen this slide in the past, and we update it annually. But if you follow the blue line and you look at the total annual change in total health benefit cost on a per employee basis, it's very clear. And not a surprise that has outpaced workers' earnings and overall inflation year over year. What's interesting, if you look at 2020 into 2021, is although healthcare costs still did not escalate at the rate that we may have anticipated in the past because of some of that delayed and missed care, the delta between that health benefit cost change and workers' earnings and inflation has increased. We've obviously seen huge economic impact on workers' earnings between furloughs, reductions in hours, unemployment, significant unemployment this past year. So that delta is a problem when we think about how we continue to deliver benefits to our employees while earnings have been diminished, but yet health benefit cost continues to rise. And as an employer, your budgets are tighter than ever. In 2020, nationally, we did see that large employers were reporting the smallest cost increase since 1997. But Northeast employer spend, although, and I'm going to focus on the 50 to 499 employee market, and then we'll also share the 500 plus within the Northeast as we go through the next few slides. But what you'll notice here is that in the Northeast, although costs from 2019 to 2020 increased 4.1%, the starting point, that base, is much higher compared to national averages. And that's probably not a surprise to many of you that are budgeting for healthcare costs for your employee population. We are in an area where we really benefit from having access to great providers, high quality providers and centers of excellence compared to some other regions in the country, but there's a cost associated with that. So unfortunately, that does drive healthcare spend up amongst employers. And when we look at the, we'll call it the mid-size market, small and mid-size market of that 50 to 499, it's always been more challenging to manage healthcare spend in that space than it is for your largest employers, although they may have larger budgets. The per capita costs are a little bit easier to manage there because you don't see as much volatility. The peaks and valleys are not as significant when you're spreading that out over a much larger population. So some of the trends, what was interesting is, so although we know costs increased, and that's a known, right? What we did see is that fewer employers were shifting cost to employees in 2021. And a lot of the conversations that I was having with my clients, both in the nonprofit and for-profit sector, is, there's concern about stability, providing stability to their employee population. It was such an uncertain year and a time where so much was unknown. There was a lot of flux within organizations. There may have been reductions in force. There may have been furloughs. There may have been hours reductions. Most organizations did not have cost of living adjustments. So there was a lot of heightened sensitivity towards shifting costs, more cost to employees, even though your health plan costs were going up. And when we talk about shifting costs, we talk about that encompasses not only per paycheck contributions, but also plan design changes. So things like deductibles, coinsurance, copays increasing. So fewer employers, actually less than a quarter of your 500 plus employers, and then your small mid-market, only 17% reported shifting costs to employees. And in fact, some were actually even making changes to make health plans more affordable. And when, in this area, it's not that we necessarily saw huge reductions in deductibles or copays to enhance benefits packages significantly, but we saw that employers were starting to be really mindful of, is there a lower cost option? Is there a way that we could do something different to provide more affordable plan to our employees? And affordability could be point of entry. So reducing the per pay, having a plan that's less expensive to enroll in, or it could also be having a plan that has less cost associated when accessing services. That could have been a more limited network. There are several different options there, but we did see some employers really taking the step to try to make some changes to make health plans more affordable. What we did see as well is many employers adding resources to support their employee population. This was a significant number of employers. So in that mid-market space in the Northeast, we saw 43% of employers, and your larger employers at 59% that had added or expanded benefits or resources. So what does that mean? So the top 4 areas where employers added benefits and resources to support employees in 2021 the one of the top here that's highlighted is incentivizing, adding, or expanding virtual care. So that's your telemedicine, digital health resources. So giving people more access to care telephonically, virtually. So 27% of your 500 plus employers and 21% in the 50 to 499 market had made changes in that area. And again, that could also be partnering with your carriers to understand what those services are and promoting them. We also had a number of employers really looking at adding programs and services to expand access to behavioral health care. And this is, some of that was done virtually. A lot of the work that we've partnered with employers on are around looking at some of those, and we'll talk about point solutions a little bit more, but specific to behavioral health, we saw a lot of employers looking at things like, talk space or headspace. It could be Calm, the app Calm, so mindfulness, meditation. We also saw a lot of employers focusing on things like training. We saw mental health first aid training this past year. There have been meditation lunch and learns and different guided supports and resources, really understanding that, access to mental health services and substance abuse services was a challenge pre-pandemic. It has been exacerbated by the current living situation and working conditions. One of the other areas that we saw a lot of traction is around adding or expanded voluntary benefits. So it's interesting because some people would say, well, employees are really struggling with their per paycheck deductions as it is. I don't want to add voluntary benefits because it's, another area that's going to come out of their paycheck. But we actually saw requests. We've seen a lot of employers looking at this as a way to help supplement their benefits program to help shield employees from some of the financial risk associated with some of the catastrophic claims. So when you think about supplemental medical plans like accident, hospital indemnity, critical illness, having some of these voluntary benefits in place can help protect an employee in the event that something unexpected happens when we are dealing with high deductible health plans. The other area, there's two other areas that really got a lot of attention this past year. One is financial resources, so voluntary benefit programs that may address some financial support from a budgeting perspective. It could be something like tuition loan repayment and some other financial advisement, because people really have been struggling, right, during this time in particular with potential loss of income, whether it's them or a family member, and maybe added expenses with childcare and things of that nature. But one of the top requested benefits is, and if we were in the room, I'd take call outs right now, but I'm sure some of you could probably guess pet insurance. So during the pandemic, there had, no surprise that many people have adopted and purchased four-legged friends and have been looking into and requesting pet insurance. So it's definitely a benefit that it's gaining more traction. And lastly, targeted health solutions. So this specifically in the survey asked if you as an employer have added a separate target health solution. So most view this as kind of contracting with an outside party to provide a service to a segment of your population, maybe that's struggling with a specific ailment or chronic condition. It could be something like diabetes care management. It could be musculoskeletal. What I will say here is that although, in the market segment that most of you on the line are today, the carriers in a lot of cases have formed alliances and partnerships with these vendors to provide additional support and to provide access to these point solutions without you having to go out and contract with them separately, without having to worry about some of the minimum thresholds that a Livongo or an Omada on the diabetes front or a Hinge on the musculoskeletal side may have in place. So this is an area I definitely encourage you to look into a little bit more if you haven't already, understanding kind of the utilization of your population and what they're struggling with and what your carrier partners can bring to the table, because a lot of them have resources and alliances that they've formed, and sometimes they just don't do a great job communicating it back out. So talking about the health plan specifically a little bit more, I don't think that HSAs are going anywhere, but it's really interesting that a lot of employers have moved away from offering high deductible HSAs as a full replacement. So we had seen a huge uptick in total replacement HSAs for years. But when we look at the 2 years that are captured here, 2018 to 2020, if I look at the light blue on top, so 33% of employers did not offer an HSA plan in 2018, and that's down to 18% in 2020, right? So we still see a big uptake in HSA offerings, but the offering HSA as a full replacement number was at 13%, and now that's down to 10%. And what I've seen with a lot of employers is recognition that, you know, maybe what we want to do now, we have these plans in place, is we want to focus on education, but we're also, there's a little bit of a recognition that, you know, we don't have this one size fits all model, and it doesn't work, the one size fits all model. And some feedback from recruiting and, you know, exit interviews is that, you know, these traditional PPO type plan designs are still really valued. Having, you know, deductible coinsurance, copay plans rather, that maybe aren't high deductible health plans are valued, and some people are willing to pay for them. So we are seeing employers look at kind of ensuring that their program provides choice, and that may mean not having an HSA as a full replacement. One of the other trends that we're seeing, and it's definitely has a much slower trajectory, I would say, for your small and mid-sized employers, is adding options for employees to actively select a provider network at point of enrollment. So meaning having a, you know, value-based care plan, like a high-performing network, accountable care organization, things like that, where it's a more limited network, but allows people the option to opt into it at either a lower price point out of their paycheck, or maybe provide an enhanced level of coverage so that when they actually access care, they're paying less out of pocket at the time. Again, this is something, it's a trend in the marketplace, but it's something that's definitely much slower, has a slower rate of adoption amongst your small and mid-sized employers. One other area that we just continue to see a lot of attention around is your prescription drug program. So this is specific to specialty drugs, which for most employers account for probably about 25 to 30% of your total healthcare spend at this point. Your prescription drugs account for probably 25 to 30% of your overall spend, and specialty tends to be the vast majority of that. So another great thing, right, from a healthcare landscape perspective is that we have access to these amazing life-saving drugs, and drugs that can cure childhood blindness. I mean, how do you put a price on things like that? But there is a price, and they're expensive. As a fully insured employer, you don't have a lot of options on kind of what position the carrier is going to take and how they're covering these items, but there are different levels of prescription drug programs that you can purchase, whether it's tighter formularies, more restriction, pre-authorization, things like that. And as a self-insured employer, you have a lot more options. And I would definitely recommend you look into how the specialty meds are being managed, you know, how they're being covered and delivered in terms of site of care, place of care, and what cost management strategies have been employed. And one of the last trends we're going to talk talk a little bit more about rather is telemedicine. So we saw a huge jump in telemedicine the first half of 22 when the survey was released. But those numbers here going from 7% to 14% over that 4-year period, and we're seeing double, right? I was just in a utilization meeting yesterday, and one of my clients' telemedicine utilization increased over 6,000%. And I know that number sounds crazy, but a lot of employers are seeing over 100% increase in telehealth. And just want to be clear that we're talking about telehealth utilization through some of the partnerships with organizations like Teladoc, MD Live, AMWell, as opposed to having a virtual visit with your own provider. So that's looked at a little differently. Most employers that did waive cost share for a lot of telehealth to really try to encourage people to continue to access care are going to be reinstating it for 2021. We're seeing the carriers already doing that. But the message here really is that, telehealth is a more cost-effective way to receive care for many services. I'm not going to take away at all the importance of having a direct provider relationship and getting into the office when you need to. Because it is very important, but there are some things that can be done safely and effectively virtually, and continuing to look at what those options are within your health plan and encouraging employees to utilize them will ultimately save your plan and your employees out-of-pocket cost. So telemedicine, virtual care here to stay. Most people have been really satisfied with it. Most employers anticipate it taking a larger role. So not anything incredibly surprising here. As we continue to think about telehealth and how we're accessing things virtually, the next question is, are we going to continue to work virtually? So are employees returning to the worksite? This is, when we look at what's been reported here, and again, this was a little bit earlier, towards the end of last year, this particular survey data, we looked at about a quarter of employers that reported said, our people never left the site, right? They're essential employees. And of course, you're going to have, even within that, some employers that have, maybe HR function was still, I know with some healthcare providers, HR function stayed remote for a period of time, even though healthcare providers were in the offices. You may have within this group similar stories for retail, for manufacturing. So even though they still maybe had to perform on site for the majority of the work that they were doing, there are some roles and positions that may have been removed, have been moved to remote. We saw about a third of employers that said we expect most employees are going to actually be at their usual work site at some point in 2021. And we're still early in the year, and a lot of employers are looking at targeting the fall for trying to return to work. Our office here, usually with about 100 people, I would say. So pre-pandemic, we had close to 100 people on this floor. I came in this morning and expected to only see like one other person, and I've actually seen 4 others today. But capacity is higher than that, but people are hesitant. There are people that are hesitant. There are people still dealing with childcare issues. And there are also some people that are just really have gotten pretty comfortable working from home and the flexibility that that's afforded. So I think we're going to continue to see things evolve there. We know that some employers said we're changing the way we operate, and we think that many employees are going to continue to work remotely through 2021 and maybe beyond. And then, a good third of employers that are saying, we really don't know what's going to happen yet. It's too soon. And, we're in a position where we can take our time a little bit and kind of really figure things out. So when we think about going back to work, or we think about just kind of the safety of our workforce, we talk a little bit, we've talked about the vaccine, we've talked about employers' roles. We've had several discussions and webinars throughout the past year that we've shared our thinking. And most employers are not considering a mandate for the vaccine. And those that are would definitely want to, and have stated they will, permit exemptions for religious, health, and other reasons. There are some that have considered incentivizing as opposed to mandating, but even those numbers are low. And why, right? So there's concern. There's real risk from a compliance standpoint, from an employment labor practice perspective. There's concerns about vaccine safety, potential liability if someone has a reaction, inconsistent approach with other vaccines. It's hard for an employer to take a stance and say, you must do this. We think that, the majority of the employers that have said that the small segment of the population that said we're going to require it and mandate it, a lot of them are probably the same employers, healthcare employers that could be healthcare employers, it could be some, education roles, but that really are, may have even considered flu vaccines in the past as mandatory. So I think each organization has to evaluate and make this decision on their own. But, this morning I woke up to the news alert on the Johnson & Johnson vaccine and the recommendation to pause temporarily while they investigate a potential complication there. We feel strongly that vaccinations are critical to kind of helping us to move forward in the future, but you do want to be really thoughtful around what information you share with your employees and have a strategy. So we have seen overwhelmingly that most employers are going to explicitly encourage employees to receive the vaccine. And from a strategy perspective around communications, 38% have a communication plan in place already, 55% are going to develop one, and 7 have said, not really. But it's not surprising that 93% of employers are communicating or plan to communicate with employees, right? And in our work with our clients, we've seen many employers sharing reliable sources of scientific information regarding the vaccine. So commonly referring people to the CDC information, common side effects, vaccine safety, who should get it and when, really focusing on educating employees. But what I would say is, before anything, you really need to think about, you need to build trust with your population. And if trust is an issue right now and engagement is an issue, then it's going to be even more important on how you communicate your desire or your encouragement of vaccination, because if employees are not trusting you as an employer and they're receiving this information, they're not going to necessarily receive it in a positive light. So it's something to be really mindful of. We have a lot of employers that have struggled with trust during this period. We've had some employers that we work with that have said, hey, our engagement and our trust levels are higher than ever because of some of the response, and others that said, hey, we floundered a little bit at the beginning, and we lost a little bit of credibility with our population, and we're trying to work on rebuilding it. So it's really important to have a good pulse on your population and where that trust factor is right now. And as you continue to, kind of think through the future, we are, definitely seeing more flexible working. And I spoke about it a little bit earlier in terms of kind of what that return to work may or may not look like for some employers. When we think about the flex working post-COVID, a lot of employers, 87%, have said, we're anticipating that some of this flexibility is here to stay. And we've seen really positive things come out of it. There's some high performing teams that have emerged remotely. There have been employees that have expressed their ability to now manage multiple things at home that were really challenging for them before going into the office every day or going to their place of business every day. So this is really encouraging. And I think employers are also looking at this as an opportunity to kind of reevaluate their physical footprint and, what office space needs to look like, what it doesn't need to look like, where can they do things more efficiently and effectively. But it's also creating a lot of discussion and talk around how to support this population, because it's really hard today to disconnect from work if you are working fully remote. When I leave my office today, I'm going to be able to shut my laptop down. I'm sure as soon as I get back home, I'm going to be plugging it right back in. But the majority of the time, I'm home. So many of us are in our home environment. We're on all of the time, and the expectation for responsiveness is even higher. It's not, well, it's 9:30 at night. It's 9:30 at night. What else? Or are they sleeping already? Like, what else are they doing? Why aren't they responding to my email? And something that one of our business leaders, a couple of different things that resonated with me recently. One was, we don't work where we live at work. And that's food for thought there, right? And being really mindful of the fact that people are struggling. And when we kind of think about how it's impacting employees, you really want to be mindful of the fact that employees are doing more, a lot of employees are doing more, or they're being more productive, but there's a price. Mental health is a big piece. So when we think about benefits for remote workers, mental health is definitely a big piece that we want to focus on, because people are having a much harder time disconnecting. The rate of burnout is anticipated to go through the roof. So you want to be really careful there. Some of the other things from a remote work force benefits perspective, some employers are looking at reimbursing for things like ergonomics, office equipment. So if it's a standing desk, a better chair, internet utilities expense, we're not seeing a huge number of employers that have done that. And I think some of them have rationalized the saving on commute and the flexibility to not provide those additional benefits. And some organizations simply couldn't afford to, right? But we are seeing more support on the digital mental health side. We're also seeing more employers organize around trying to encourage engagement through social activities and events with their workforce. But as we continue to look at focus and employers and organizations focus in 2020 and 2021, we're seeing a lot of people take a step back and focus on DEI. And we could start with that wake-up call that we got this past summer with the protest that sparked by the killing of George Floyd, and really ignited conversations and organizations across the country, both large and small, about what they could do differently to really help end that systemic racism. So there's hopeful signs that greater awareness is leading to action. And in one of our surveys back in November, we asked companies if a focus on DEI has changed and increased in 2020. And the great majority, 75%, said that it had. So most encouragingly, 40% strongly agreed. So this is definitely an area around thinking about thinking about your culture, thinking about your recruiting practices, thinking about pay equity, your benefits program, inclusive benefits. So there's a lot of different areas of diversity, equity, and inclusion that need to be explored. And most employers that we're talking to have started to have those conversations, and some are further down the road than others, but definitely an area that remains top of mind. So from a kind of wrapping up the survey, and we'll jump into strategy for a little bit, is engagement. And our key takeaways, really, employers need to pay close attention to engagement. And all of these different factors amongst your total rewards philosophy, through your benefits, through your pay, how you communicate with your employees, it all ties into engagement. 1 in 5 employers said that employee engagement has increased since the pandemic began. That's great. Well, 1 in 5 also said that it decreased. So that's not encouraging, but it's not surprising. We've had some instances where people have reached out more to their teams, have reached out more to engage with colleagues because we're not seeing them face to face. So maybe more regular touch bases were scheduled that gave opportunities to have more meaningful discussions that maybe weren't happening passing at the water cooler. But there's also a lot of people that became very disconnected in this environment, and engagement decreased, and that could have been the disconnection because of all of the different competing priorities at home, not seeing people on a daily basis. It also could be how some of these organizations manage the response to the pandemic. So a lot of different reasons that people, that engagement's been impacted in both positive and negative ways. But we're hopeful, right? So as 2021 gets underway, my goodness, we are in the middle of April already. I don't know how we got here, but 78% expected that business results in Q1 were going to be good or better than pre-pandemic. 57% were hiring at above pre-pandemic levels at the end of Q4. And 89% say that productivity was at or above pre-pandemic levels, which is incredible. And that really gets to some of the discussion around the high-performing teams that have emerged. But again, keep in mind that some of that productivity is the result of us not disconnecting. So we really need to be mindful about kind of putting on, one of our other leaders last week had said, go purple. So in your Outlook calendar, if you're using Outlook or whatever, I'm sure some of the other programs have a different color maybe, but purple is out of office. It's kind of like, I'm unavailable. You really can't reach me. And the message was kind of go purple once in a while, block something, hold yourself accountable to that. And it's so hard. I mean, I know how many times I've blocked things, and then I'm like, no, you can schedule over it. That's just my hold to try to, go to the bathroom and eat lunch before, 4. But it's holding yourself accountable, and we need to take care of ourselves and each other. So encouraging your employee population to do the same, obviously, within reason. Work needs to get done, but it's important to preserve kind of that overall work-life balance, which we all seem to be lacking these days. So I'm going to, so I think we take all of this information, right, about what's happened, what we anticipate, and try to best prepare for the future. So when I think about what that looks like, I think about this little boy here in the picture with his goggles, his elbow pads, and a cape. He's ready to take on the world. And as employers, we need to go into the brave new world trying to be heroic, while still ensuring we're thoughtful, right, about our approach and being cautiously optimistic. So imagine a future state where employers are deriving greater value from their benefits, where a benefits program produces optimal outcomes for both you as the employer and your employees. We're envisioning a state where the 4 outcomes you see here are the norm. So delivering clear, differentiated value to you and your employees. We know we've made progress in these areas, but we also know there's more work to be done. So we're going to jump into how employers are really imperative to driving this change and capitalizing on the market forces to achieve the outcomes and truly reinvent for value. Employers are uniquely positioned to reinvent for value, to achieve this vision, and really essential to transformation. I mean, first, when you think about it, employers together have market leverage. You provide more than half of all insurance coverage in the United States. Secondly, employers can drive the providers in their local communities to higher quality, as well as encouraging national payers to push for value-based care models. Employers also have a financial imperative for the business and for employees out-of-pocket costs. So since employers continue to reimburse double of Medicare levels on average. We know employers can't rely on the other stakeholders in the system because they have a vested interest in maintaining the status quo, right? They're making money on it. So over the past few years, we've seen employers making great strides and collectively really pushing the market forward. We've seen adoption of some tools to advance the consumer experience in healthcare. So price transparency applications, advocacy solutions, AI-enabled tools to help guide members really to obtaining the most relevant healthcare for them. And some employers, mostly in the larger market today, though, have incorporated some of those value-based care in plans. So we talked a little bit about that with the accountable care organizations, the narrow networks. But overall, employers have increasingly been willing to embrace disruption and to start thinking about things in new and different ways. So there's a great foundation to build upon. And 2020 has really accelerated those existing market trends, driving the need for employers to really focus on value like never before. So we're going to talk about what those trends are. So the first macro trend we're going to talk about is really just the economy. The economy is very volatile. Employers can't afford to waste money on low value benefits. COVID has completely changed the way our economy has functioned as governments put stay-at-home orders in place. As an employer, you are a financial steward to your business and your employees. You can't afford to waste money on low value benefits that don't serve your workforce. And there's also concern about what could be that surprise trend in terms of COVID costs, deferred care. We don't know what that future, I talked about that at the very beginning, we don't know what that will look like yet. So now more than ever, we know that those cost pressures, they're leading to total rewards decisions for employers, and that extends into benefits as well. So employers are really starting to evaluate strategies that may have been thought to be too disruptive, too aggressive before. They're now back on the table. There's a definite focus on cost. Unemployment rates have fluctuated so much. There's financial challenges that have impacted a lot of employees who not only lost their jobs, but also financial concerns about potentially family members, right, who've lost their jobs. And those concerns negatively impact productivity. So as we start to plan for 2022 and beyond, we're going to talk more about, we talk more about how you can drive value in your benefits, focusing on investing in what's truly valued by your employees, making sure that whatever you're offering is supporting their financial health, revisiting your guiding principles, really, and making sure that your strategy is aligned with kind of the changes in the environment. There's also, health and care delivery is under a microscope. So one of the other macro trends we're seeing is really employers focusing on providing high value care in order to ensure that members are getting the right care at the right cost and at the right time. So employers really have had a much greater appetite to embrace provider disruption in some cases, although we're seeing still very low uptake of some of those accountable care organizations and narrow networks for your small and mid-sized employers. Employers are starting to say, well, is there a better way? Is it possible that if I do steer my employees rather to specific providers, that it's going to save us money, save them money, and they're still going to have high quality care? And the answer is yes. So it's definitely something to look into. There are a ton of resources and tools to help support that steerage, that education for employees. And really ensuring that kind of that virtual front door is the first stop in the care journey. So ensuring that people have a place to go to be able to access care and help them make decisions about their care before they're accessing it. One of the other huge areas of focus is really around kind of the disparities that exist today. Employers cannot roll out and successfully support a program without ensuring that they're supporting a diverse, equitable, and inclusive workforce. The one-size-fits-all approach does not work. COVID has really shown a bright light on some of the disparities, the racial disparities within our society. Prior to COVID, there were racial and ethnic minority groups had much higher rates of chronic disease, obesity, premature death. The pandemic has further exposed some of these disparities, and now employers really have a fresh opportunity to support that diverse and equitable and an inclusive workforce, really by challenging the status quo, committing to support the health and ensuring that their benefits program are valued by their entire workforce. So we're seeing employers really take a step back, looking across all employee segments, ensuring that their program is inclusive, that benefits are valued, and that it's meeting the needs. And then also ensuring that they're removing any potential barriers for access, social barriers, socioeconomic issues. So that has been really critical. And then as you're continuing through your planning process, really understanding kind of what is that new shape of work, ensuring that employers are really reassessing the value of their offerings, and then it's aligning with the way employees are living and working today. So flex work being re-examined for sure. What does that look like? How do we support it? Can we support it? Employers are being challenged really to ensure that they're providing employees with, first-rate experience from a health and well-being perspective within a virtual work environment, which is not easy. Behavioral health is top of mind. It's a critical component to your overall well-being program, and something that definitely you should have a close eye on the trends in your utilization there, and ensuring that employees have access to support services and feel that they can utilize them, and that you care ultimately. Ensuring that as you're looking at this too, do PTO policies need to be restructured? Do you need to reestablish what those programs look like for the new norm? And a huge area of focus really is on supporting working caregivers, because we don't know what tomorrow looks like. We are so fortunate that I don't know if all, or if not all, almost all of our school districts within Westchester have reopened to full-time in-person instruction as of this week. Most of them. There's still maybe some stragglers, so I don't want to make the blanket statement, but there's still a lot of people that have concerns about sending their kids back full-time. There's still districts that are not full-time. And then guess what? We could be in a week and then all of a sudden a whole class is exposed and there's a quarantine again. So there is still a real need to support working caregivers, and it could be childcare, it could be elder care. And that, so it's a real challenge, and employees are looking to their employers for support. So the road ahead, there's still work to be done. We believe that employers can absolutely reinvent for value. We believe the future state's achievable. Collectively, employers have achieved a great deal over the past few years in pushing for transformation. Employers can analyze cost and quality with some of the advancement of the quality measurement tools. There's more options that exist than ever before to implement value-based care, quality-focused health strategies. We've also seen a sharp rise in options for designing some of these really cool consumer experiences to engage virtually with their health program. We do believe employers can further to drive that change by measuring value of programs in place today, striving for continuous improvement, setting those goals ahead of time. Ultimately, if you stand by idly, changes to the value equation are not made, then that inaction is going to cost you more in the long run. Healthcare delivery would remain fragmented and burdensome for employees and their families, which translates to costs continuing to rise, employers continuing to pay the lion's share of it, and quality is going to be in a black box without that transparency. So overall, that results in dissatisfaction, frustration amongst employees and employers who are really trying but failing to keep costs at reasonable levels. So it's not sustainable. We know working together, things can change because they have already with the work that's been done. So I'm going to close with strongly encouraging you to talk to your consulting partner today to plan for 2022 and beyond. There's a lot to think about, many strategies to vet, and that path is going to be different for each employer. And before you know it, renewals and open enrollment are going to be upon us. If you are a calendar year, it's strategy time now. If you're mid-year, you're probably starting to wrap up your renewal decisions. But there's discussion around communications and what should we communicate to our workforce? What strategies, are there extra tools and resources and supports that we want to try to communicate during this time? You don't get too many shots usually at communicating with your population, depending on the organization, but open enrollment is one that you definitely want to take advantage of. So I just wanted to leave up this last screen before we jump into the chat for any questions. We have provided some of our resources here that are available to employers through Mercer to help keep you abreast of the latest developments from a healthcare landscape perspective. The survey data is highlighted here, and as well as our law and policy insights, which has some really timely updates from a regulatory standpoint. So I truly thank you for your time today. I know we covered a lot, so I apologize if I went fast. I think we have a few minutes for questions if you'd like to enter them into the chat. I apologize for averting my eyes. I've got two screens here, so I will look over now to see if we have any questions in the chat. Oh. Let's see. Okay. Oh, I can't hear.
Teresa, there are a few in Q&A.
Okay.
Okay. I can read one. In the 50 to 500 market, have you seen any shift to self-insurance in the 2020 survey?
I see that. Great. Thank you, Chris. Thanks, Marcia. Thank you, Chris. Interesting question, Chris. So, we're seeing some shift there, and I would say that employers have been, and it's on an employer by employer basis, right? Because I think there's a lot of opportunity for you to do more within your benefits plan. I talked about prescription drugs a little bit earlier and some of the levers you can pull even just there, right? When you self-insure that you can't necessarily affect in a fully insured plan, and getting a lot more access to data and transparency in kind of what's driving your healthcare spend. But depending on what your specific claims experience is, I've also seen some fully insured carriers be really competitive on renewals where it still didn't end up making sense at the end of the day. So, I think that what I would say is there's an appetite for sure and a strong recommendation to look at self-insuring and the different components of your program that you might want to self-insure. I think it definitely, you want to make sure that you have a partner that's vetting the market, looking at stop loss costs, making sure that they have alliances and programs in place to really help control, because once you do go from a fully insured to a self-insured model, it is a little bit harder to get out of it. So I think it's a great question. I think it's absolutely something that we're seeing. I don't have that specific statistic. I'd have to look back. I don't have it top of mind, but we do have, in our survey data, we do have a breakdown of employers by segment that are fully insured versus self-insured, and some of the other hybrid like minimum premium. So I can definitely follow up on that.
Great.
Thanks,
And
Chris.
one more question, if there's time. If not, maybe the person can email you separately. What are the first steps we need to take to focus on D, E, and I?
Yeah, so that's a great question, and I will be the first to say, so if you missed, there was a presentation
Yeah.
that two colleagues, Angela Berg and Bill Rubich, gave last month, and I believe the replay is still out there, and I will not pretend.
It's in the BCW's Business Resource Center. So so the person can look at www.thebcw.org. It was an excellent presentation.
Yeah, and so I won't, it is not my area of expertise, but I will say that strategically, the first thing that really you want to do is assess, and this is my own thought process. So it's not the thought out plan that you'll see from Angela and Bill, but is you want to assess kind of where you are today, and understand what you've looked at in the past, and really kind of then formulate kind of next steps there. So that there are a lot of different facets. So thank you. I'm sorry, I know we don't have a lot of time to get there, but thank you, Marcia.
And just really quickly, with self-insured employers looking to increase utilization in some of their targeted health solutions, are you seeing employers thinking of different ways to engage their employee population? You can do that in 1 or 2 minutes, and then we can close out.
Yeah, so absolutely. Employers, so target health solutions have become all the rage. There are a ton of vendors, right? And we had this clamshell slide that just goes into every category, and there's 12,000 different vendors in the market. So we spent a lot of time vetting them. We actually have a team in our Center for Health Innovation that vets them. But employers are absolutely looking at these target health solutions to engage their populations in different ways. And what I would say is, you first want to start with understanding your plan utilization and what those areas are that you want to focus on, and not throwing the whole kitchen sink at your employee population. So identify a few key areas. You could even start with one, depending on your organization, and then look at the different vendors, understand fully their capabilities and how they can help engage your employees directly, and can they work with your carrier partners that are already established. So from a data flow perspective, in some cases that can be really helpful.
Great. Teresa, you have provided absolutely amazing and very concrete and powerful information to the listeners today. And I saw a lot of very, very interesting companies. I think it really struck me that one of your last slides said employers can reinvent for value. I believe it said, and this is the employer population you're talking to, and to have Mercer as part of the BCW with the great expertise that your company shares in so many different areas really is a fabulous, fabulous resource. If anybody has any other questions, I offer my own email, which I will then share the question with Teresa. I'm at mgordon@thebcw.org. So if anyone has any questions afterwards that we'd like to follow up with Teresa, we will do that. With that, we thank everybody for your attention. Teresa, we thank you for a really, really productive and powerful webinar. And we wish everyone good health. Have a great day. Wear your mask. Enjoy.
Thank you so much. Stay well, everyone.